basis of understanding medicine dynamics in today's world. Rapid changing world, influenced by technological advances and artificial intelligence, depends on the simplicity of the subject. And that's why I welcome you to a series of lectures prepared by Dr. Silvanus in a very simple language in order to enhance your journey and facilitate your journey when it comes to taking actions for healthy living and a healthy lifestyle. Consider subscribing, consider sharing, consider asking questions. And in a very unique way today, I'm going to present to you a topic headed National Essential Medicine List. Let's get it done. First and foremost, I would like to appreciate the staff behind the performance of these lectures. These lectures comes as an inspiration and motivation to simplifying medicine. Medicine has been complicated to the point those who pursue medicine, they drop it out. But it was meant to be simple even to the lowest community. Be able to use and apply it for community wellness. As introduced earlier, today's lecture goes by the head National Essential Medicine List. It's a basic lecture. It's a basic lecture of National Essential Medicine List. The WHO, World Health Organization, do researches, make publications, and make guidelines to help the doctors make proper decisions when it comes to healthcare. But all the decisions and all guidelines made by the WHO are concentrated for public benefit rather than single entities. So they are most concentrated for public benefit rather than single entities. Why public benefit? They are concentrated for public benefit in order to reduce the burden of costs when it comes to health-seeking behavior. So the WHO does amendments, make guidelines, make essential protocols to be followed. All they are best for public benefit or community benefit rather than single entities, rather than single investors, stakeholders in healthcare, in order to reduce the cost, the health burden, the cost when it comes to health-seeking behavior to the community. Now, it came with essential medicine list idea that these are the essential medicine should be present in health facilities at all time. These are medicine lists to be present in different healthcare facilities at all time in good quality and affordable cost. At all time in good quality and affordable costs. Now, in Tanzania, we have different types of healthcare facilities. We have level 1 healthcare facility, level 2 healthcare facility, level 3 healthcare facility, level 4, and level 5. Their difference is the ability, the level, the ability of the care they provide. Level 1 facility provides a very limited health services as compared to level 2, which provides extended services, as compared to level 3, which provides more extended type of care, compared to level 4, which provides more extended type of care, as compared to level 5, which provides more extended type of care when it comes to health services. And so the type of essential medicine present in this level of cares will also differ. Essential medicine will also differ. The essential medicine will also differ depending on the level of care in these health facilities. We will have a very short list when it comes to level 1, and extended list when it comes to level 2, extended to level 3, level 4, and level 5. For instance, in level 1, you will find drugs enlisted such as paracetamol just to treat pain and minor discomforts. But in severe pain and severe discomfort, other levels such as level 3, level 4, you will find some kind of drugs such as pethidine, and tramadol, and etc., just to treat severe pain, but also severe infections and chronic issues. So the number of drugs enlisted which are seen to be essential in level 1 will be different to the number of drugs which will be essential in level 2, level 3, level 4, level 5. This is very important in order before you take action to go into a certain health facility, at least you get to know which kind of services are going to be provided and which kind of medicine are enlisted to be provided by that specific care level. Now, medicine list, depending on the level of care, depends on the priority disease. The priority disease which will be at level 1 will be different to level 2, different to level 3, different to level 4, different to level 5. As we have seen here, some paracetamol just to treat minor pain and discomfort, as compared to level 5, level 4, which are there to treat severe issues and chronic pains. So the priority of disease will guide the type of essential medicine that is needed in level 1, level 2, or level 3. Now, selection of drugs depends on supply, efficiency, and affordability. But what facilitated now to come to the idea of essential medicine? Assume in level 1 care, antibiotics are just present. They are not enlisted to be in this level of care, but they are there and they are stocked. When it comes to prescription, freely prescription, they will lead to antimicrobial resistance because they are just available and they are no, despite they are not enlisted. So the idea of enlisting specific essential medicine to specific care level came about in order to guide responsible use of antibiotics and lower down the burden of antimicrobial resistance. Now, when it comes to prescription guideline, we prescribe the essential medicine list depending on level of service and expertise. When we start with level of service, we said we have level A, level B, level C, level D, and level S. Level A goes with the dispensaries. So all level A are dispensaries, level B are health centers, level B health centers can have an extended ability to stock and to enlist more drugs as compared to level A in dispensary. Level C are district hospitals with an ability to stock more or to enlist more essential medicines as compared to the health center and the dispensary. Level D are regional referral hospitals. These are able to stock more drugs as compared to level C, level B, and level A, whereas level S are zonal referral hospitals and national referral specialist hospitals, which are level S. These are entitled to an extended list of drugs which they can stock and which they can prescribe. Now, depending on level of expertise, we have A, who is assistant clinical officer, and B is a clinical officer, and C is assistant medical officer, while D is a medical officer or medical doctor, and S is a super specialist. So, the level of expertise, there are some of the drugs enlisted in these health facilities which can be prescribed by assistant clinical officer, and others are enlisted to be prescribed by clinical officer, and others are enlisted to only be prescribed by assistant medical officer, and the other are enlisted to be prescribed by medical doctor or medical officer, and the other are enlisted to be prescribed by super specialty. Now, in dispensaries, we have assistant clinical officer in charge. So they are entitled to prescribe all the medication which are essential in dispensaries for just treating minor complications and discomforts. At health centers, the clinical officer are entitled to take charge of the health centers, and they are entitled to prescribe medications which are enlisted to health centers. District hospitals are in charge by assistant medical officer, but they are able to prescribe only medications which are enlisted to their title, where the regional referral hospitals are entitled to medical officers or medical doctors, and there are drugs which are enlisted to be prescribed by medical doctor in regional referral hospital, whereby in zonal referral hospitals or national referral hospital, only the super specialty are entitled in charge of these hospitals, and there are more extended list of drugs which can be prescribed by super specialists and not be described by medical doctor, assistant medical officer, clinical officer, and assistant clinical officer. Now, here we have a zonal or national referral hospital. Zonal referral hospital or national referral hospital. As you can see, it's a big facility able to occupy and to stock an extended list of medications, an extended list of medicine, which can be prescribed by assistant clinical officer, assistant medical officer, and medical officer, and super specialty. So the super specialty here is in charge and is able to prescribe all medications which can be prescribed by all other level. But when we have assistant clinical officer, they can only prescribe in their level and same according to their levels. What about regional referral hospital? Regional referral hospital is not in charge of super specialty. It's in charge of a medical doctor or medical officer. So if we have a medical officer or a medical doctor here, they can prescribe medication enlisted to level A, level B, level C, and level D only. They can't prescribe medication enlisted only for super specialty in regional referral hospitals. Now, what about the district hospital? The district hospitals are entitled to assistant medical officer or AMO. Now, they are able to prescribe medication in their level A, level B, level C. If you remember, level A is medication prescribed by assistant clinical officer, and level B, the clinical officer themselves, and level C, the assistant medical officer. But they can't prescribe the medication enlisted to medical officer, no super specialty. What about health centers? Health centers are enlisted in charge of a clinical officer. Now, they can prescribe medications only in level of assistant clinical officer, and the clinical officer himself. But they can't prescribe medication enlisted to assistant medical officer, and the super specialist. What about the dispensaries? Dispensaries are enlisted in charge of assistant clinical officer. They can only prescribe medication at their level enlisted to assistant clinical officer. They can't prescribe medication enlisted to clinical officers, assistants, medical officer, and super specialist. So depending on the level of care is enlisted number of medication which can be stocked and which can be prescribed. And so, depending on the level of care, enlisted the in charge who are able to prescribe. Now, a question comes, what if a super specialist goes to visit this healthcare facility? When they go here with their medications and they find someone in need of super specialty medication, they are able to prescribe. Same to a medical officer, they can prescribe. Same to clinical assistant medical officer, they can prescribe. The same to clinical officer, they can prescribe. But he cannot prescribe the medication which are enlisted to be prescribed by the other senior staff. We have two types of super specialist institution in Tanzania. We have National Referral Hospital and Zonal Referral Hospitals, where we can get the super specialist appointments and the super specialist consultation, and where the super specialist medication are enlisted. When we start with National Referral Hospital, these are the national hospitals which are super specialist arranged for specific consultation and specific medication. For instance, we have the Muhimbili National Hospital. Here is where we can get super specialist consultation and enlisted big extension of the drugs because of the nature of the services they provide. They provide super specialist consultation based on orthopedics, where we get Muhimbili Orthopedics Institute called MOI, but also at Muhimbili we can get more maternity and reproductive health medication and listed. We have the Cardiac Institute, which is more of cardiac super specialty and listed medications only we can get there. But also we have Kibongoto Hospital in Kilimanjaro. This is more super specialty when it comes to tuberculosis. But zonal referral hospitals where we can get super specialty consultation and extended list of medications are KISMC. This is Kilimanjaro Christian Medical Center in Kilimanjaro. This is in the northern zone. In the southern zone, we have Mbeya and Mtwara Southern Hospital. These are the zonal, the southern zone, a super specialty hospital where we can get an extended list of medications and listed to super specialty. In the central, we have Benjamin Mkapa referral hospital, which is more in the central zone, and in the eastern zone, we have Ugando. This is in Mwanza. So these are the type of hospitals where we can get super specialty extended list of medication and services according to the level of care. But in regional, now I will shrink to regional, and specifically I will go to Kilimanjaro. An example of a regional referral hospital in Kilimanjaro region, we have Mawenzi Hospital. This is level D care, where we get the charge of medical officer or medical doctors in charge, and they can prescribe medications which are enlisted to level D care for medical doctors to be to prescribe. But they cannot prescribe super specialty medication enlisted unless some of super specialists come to visit and they can give the medication, but they are not enlisted to give medication according to this. So what happens if somebody is in need of super specialty? They'll be referred to zonal referral hospital or national referral hospital. Now let us go down to district hospital. Coming back to Kilimanjaro, we have one district hospital currently serving as district hospital, which is called St. Joseph Hospital, because we still have a district hospital under construction at around Saranga. So the district hospital is entitled to level A, B, and C. Here is where we can get prescription from assistant medical officer as in charge of these district hospitals. Although if we have super specialists coming here, they are allowed to prescribe medications, but they are not, the hospital is not enlisted to prescribe such kind of medication. What happens if somebody is in need of the service from the regional hospital, referral hospital? They are referred. They can be referred here, or if they need super specialist consultation, they can be referred here, or they can be referred here. Now, this is district hospital. Now, going down to health centers in Kilimanjaro, these are health facilities entitled to prescribe level A and level B medications, and they are under the charge of a clinical officer. So the clinical officer, as in charge here, is able to prescribe medications at level A and level B. And health centers are in charge of 2 wards. They can give services around 2 to 3 wards. Now, what if there be need for referral? They'll be referred in regional hospital, sometimes in district hospital, or for super specialists in zonal hospital, but this is not common. Dispensaries in Tanzania, the government has tried its level best to make sure a dispensary in each ward. They are able to make service and to see around 6,000 to 10,000 population, but they are entitled to assistant clinical officer in level A care. So they can only prescribe medications which are enlisted to their title. Examples of dispensaries we have in Kilimanjaro, it is Rao Dispensary, Longuo Dispensary. These are the examples of dispensary, and they are entitled to give basic services and basic labs, investigation, and immunization before somebody is being referred to other higher level of care. Now, coming to the services provided by different level of care, taking an example, outpatient, maternity, inpatient, surgical, and super specialist. Coming to the type of service provided and the type of medication enlisted, for dispensary, outpatient services and medications are enlisted, and health centers are enlisted, district are enlisted, regional and super specialists are enlisted to outpatients and the kind of medications which can be given, especially the TABS medications. But for maternity, also dispensaries, health centers, district hospitals, regional hospitals, and super specialist hospitals are also enlisted, except for inpatient. In dispensary, they are not enlisted to give inpatient services. So all inpatient medications which require a patient to be admitted to the hospital, they are not given to dispensary. Although in health centers, are enlisted and they are able to be given, and in district hospitals, regional hospitals, and the super specialist hospital. But what about the surgical? The surgical services and medications enlisted to dispensary are not there, and in health centers are not there. But in district hospitals, the surgical medication list and services are enlisted too. What about super specialist consultations? The dispensary are not enlisted for that services. Health centers not enlisted. The district hospitals are not enlisted, except the regional hospitals and also the super specialist referral hospitals. Now, what is the significance of all this? When it comes to procurement, the stocking of medications, knowing the type of list, this helps the expertise in charge of certain facility prioritize types of medication they are going to buy so as it will be cost effectiveness to the type of medication enlisted. And now the population knows when it goes to level 1 care, level A care, there are type of outpatient medication enlisted too. But when it comes to situation, they will need to get inpatient care. They are going to the next levels, which are enlisted to give such kind of medications. When it comes to storage capacity, we will be able not to overstock, so as not to overstock a lot of drugs, which sometimes they become unused. So we will stock based on the basic service we provide, and we will know how to use it based on the service we are able to give. And sometimes it gives the basis of referral and reason for referral. When we know the type of medications we are enlisted to, we will be ready and simple for referral in case we know these medications or this condition is not our priority disease and we don't have medications enlisted in our level. So we will get a strong reason to refer a patient to the next. So in complex cases, we will be very sure to refer for the reason of medications enlisted to our facility are not present. But last is nowhere to seek medical attention or medical care. As a community, we know that this health facility is not enlisted to this kind of medication. So we will be ready to go for the next facility, which is going to be enlisted to certain kind of medication. The next presentation on National Essential Medicine List will take you to specific medications and specific expertise responsible for dispensing and prescribing specific medication. Please share, like, subscribe, follow.